counterparts, Capital Regional sees many uninsured and underinsured patients every day. Last year alone, we provided thousands of individuals with care that resulted in approximately $51 million of uncompensated care to our community. It is a concern to everyone that works in the healthcare industry, and we look forward to working with our government officials on creating a solution for this issue. Today, we are very proud that Governor Crist has chosen Capital Regional Medical Center to discuss this issue and the Cover Florida plan, which the governor has instituted to help activate participation and give these folks coverage. It is my honor to welcome and to introduce Governor Crist.
I'm honored to be here with so many wonderful professionals that work to keep people healthy. I'm the son of a doctor and I'm the brother of a doctor, and what you do in healthcare is so critical and so important, and I'm so impressed with your hospital. It's beautiful, and I love the fact that your wait time for your emergency room is so small. 10 minutes to see a nurse, a half hour on average to see a physician. I think that's maybe a model for America. I'm here to talk about Cover Florida and the health plan that is offered now through the state to make sure that people who are uninsured have an opportunity to have insurance. When I got elected governor, I found out, you learn a lot, and I found out that almost 4 million of our fellow Floridians don't have any health coverage at all. And obviously that troubles you when you hear about that, and you know what people must have to go through when they think about a family member getting sick or they themselves having a catastrophic problem. How in the world are they going to pay for it, especially in the economic times that we have right now? And so I asked our great team and our administration to start thinking about some ideas of how we could create some coverage that wouldn't be expensive and would save people money. Because right now, before Cover Florida came about, in order for somebody to get health coverage, the monthly payments were between $700 to $900 a month. I mean, just extraordinary. Some instances maybe a little bit lower, but nonetheless, pretty expensive. So David Foy really led the charge. Secretary Benson worked very hard, and they came up with a plan whereby we would negotiate with health insurance companies in Florida and try to, on behalf of those 4 million Floridians, have a less expensive plan or plans available that they would be able to afford, and therefore be able to sleep at night and not have to worry so much about being able to have coverage should they need it. And these wonderful people with some great companies came up with plans that range from $25 to an average of about $155 a month. Obviously, when you compare that to what it was before, it's a great savings. And those plans can be preventative. Those are the cheapest to cover catastrophic. And they get more expensive the more you add on, obviously, but still a lot less expensive than what was available before that. And we have 2 young people with us today. I'm very proud that they're here. I'll go ahead and introduce Carly first, if you don't mind. Carly Ramsey. She has a great story about Cover Florida, and you can tell it better than I can, so please do.
Thank you, Governor.
Yes, ma'am.
Good morning. My name is Carly Ramsey. I had a job where I had full health insurance coverage, and everything was great until I no longer had that job. So, in light of circumstances, I, decided that in our present economy, in our times, I needed to put more into me, put more into what I wanted to do. So I knew that I had to go back to school so that I could make the opportunities for myself to have some, better future for myself and my daughter. And in going back to school, that meant I no longer had, I had to look at all these options of what I was going to have to pay for myself. With my mother's help, we sat down and we started doing some research. She actually contacted her insurance agent, and he had the information about Cover Florida. Told me about this program that the governor had been putting together, and that it was very, very affordable. And honestly, when I first heard the rates, I was like, whatever, there's no way. It's really not possible. Because in light of, if you do the research of what all the other things are costing, it was just, it was absolutely fractions. So I was able to very easily and very quickly, I filled out, it was like a 1-page application, and I sent it in, and I got the coverage. And, and my payment, I think right now is like $92 a month, which is unbelievable. And I'm able to keep up all the same care that I had before. I'm able to see all my same doctors. I'm able to do all the same things. And I pay, I pay differently. Instead of this ridiculous, exorbitant, monthly payment, I'm actually just paying this tiny little bit, and I pay a little bit more for certain prescriptions and that sort of thing. But my savings, I mean, I come out with maybe $200 a month is my total expense for all of my existing health care that I had. And of course, I have the coverage for if anything horrible does happen. So for me, it was the only option that I could see. It was the only option for me, and I'm just really, really, really glad that I could have it, and glad to be here. That's my story.
Well, Rebecca Rice is with us too. Rebecca and I met Rebecca's son Dylan, a nice guy. Why don't you tell us your story?
Hi, my name is Rebecca Rice, and I was born here in Tallahassee, Florida. I'm 25 years old. I own a small business, and I also work part-time at Joann Fabrics. I've had many struggles in my life throughout my 25 years as far as health issues, and it's been almost impossible for me to get coverage. I had Medicaid while I was pregnant with Dylan, my 2-year-old son, but shortly after that I was no longer covered. As Carly said, it's impossible. You look online, you look all over, and it's just impossible to find anyone that can cover you that a younger person could afford. And I was reading the Tallahassee Democrat one day, and I saw an article that outlined the Cover Florida Protection Program, or healthcare program. And I was just very excited. And then the day I got my policy in the mail was the greatest day ever, and it's a brightening future for me and my son, and I couldn't be happier. And I just want to thank Mr. Governor, and it's wonderful.
Secretary Benson sort of runs healthcare in Florida, and Secretary, I'd like you to say a few words if you would.
Their stories are all too common across the state of Florida. Last year when the governor outlined his vision for Cover Florida, he said, we have about 3.8 million uninsured Floridians who are facing situations similar to those faced by Carly and Rebecca. He said we have to do something to make a difference. And in the last year, the numbers of uninsured have continued to go up. This week we Cover the Uninsured Week, and even last week, Families USA reported that there are nearly 5.8 million Floridians who will be without health insurance coverage sometime this year. Those are daunting numbers, and I think you all see the faces of the uninsured every day in what you do. So thank you for your service to the people of Florida. I think you know that when you don't have health insurance, you don't have the peace of mind that comes with that. So we are so grateful to you all, not just the Tallahassee Democrat for making sure Rebecca knew, but you all at HCA for making sure that we know. Your parent company has agreed to help us get the word out across the state in all of your facilities, and so I hope you'll tell your peers at all your other hospitals about the great work that Cover Florida is doing. Thank you very much for all that you do to keep the patients of Florida safe. Thank you for helping our agency on our mission to make sure we have better health care for all Floridians. Thank you, Bud, for your hospitality, and thanks for the invitation to join me today. Oh, I forgot one selfish item. And while you're helping us get the word out, we have a really great website. It is coverfloridahealthcare.com. coverfloridahealthcare.com. So if you can go to that website and make sure your friends all know about it, we sure appreciate your help in getting the word out. Thank you.
That's what it's all about. And I want to thank very much Rebecca and Carly. Thanks for your courage and sharing your story with our friends. But our friends in the media are public servants too. And they provide a great service by getting good information out to people so that they can have a better life. And that's really what it's all about.